Hi there. The purpose of today's video is to show you a breathing technique and test so you can evaluate the efficiency of your own breathing and whether it's serving you well or not. It's called the controlled pause test, and it's extremely simple to do. But before I show you the test and go through the parameters, I'm just going to give you just a little bit of background. The test was devised by Dr. Attain, a Russian physician, and he discovered that a lot of his patients were over breathing, and he started to collate a lot of information, and he realized that all the patients he had who had a very low controlled pause result seemed to have a lot more chronic diseases and were ill more often than those that had a higher controlled pause result. So he started to look into it in more detail and discovered that when we overbreathe, we're taking in plenty of oxygen, but we're expelling too much carbon dioxide. And it's the carbon dioxide, when retained in the body, helps cellular reproduction and improve the quality of hemoglobin. So he discovered that carbon dioxide, as normally seen as a waste product, was actually a vital component to our health. So how could he teach people how to retain more carbon dioxide and increase their controlled pause? And that's what he devised. So the test is really quite straightforward. It measures how efficient you are when you've expelled most of the air out of your body, and what's left it goes to work in the cells, and how efficient that is. So the longer you can hold your controlled pause, the more healthy and efficient you are. And that's what he discovered, and he actually tested in the end over thousands of patients, and so it became a clinical study and accepted by the medical board. He went on to put breathing clinics, or tried to put breathing clinics, all over Europe and in the UK. These breathing clinics never really took off fully because they needed the doctors to promote them. Well, unfortunately, doctors make a lot of money on the prescription of athanol and other drugs and prescription drugs for asthma. And so when you teach somebody how to breathe properly, well, it's free. I mean, there's no medication involved whatsoever. The only thing that the patient needs is some discipline over a 5-day period to do a breathing exercise for 5 days. And he was having incredible results and actually getting people off prescription drugs for asthma, which is incredible. So I want to show you the test and how to do it. So you need a paper and pen to record your results, and you need a stopwatch to record your heart rate and your controlled pause, and that's it. And then you do the test in the morning and in the evening over a period of 5 days, and you get an average. But the first time you do the test, it gives you exactly your current state of efficiency. So you'll know straight away, as soon as you do the test, whether you're overbreathing or how efficient you are. So the first thing is to take your pulse. The easiest way to take your pulse, rather than say using a heart monitor, is to find your pulse on your wrist, which is on the thumb side of the wrist, and use the 2 fingers from the other hand and locate the pulse. Now I'm going to take mine over 15 seconds, so bear with me. Okay, that's 13 beats, so it's 26, 52. So my heart rate's going at 52 beats per minute. So I just write that down and make a record of it. And then I take my controlled pause. Now, in order to do this, you simply breathe in and then breathe out. Now, I don't want you to breathe out until you're choking. Just breathe out until you feel comfortable. At that point, just hold your breath and time it. Now, I'm not going to do a full test for you now because it's a little bit boring for you to watch me hold my breath, but I'm just going to show you simply what to do. So you breathe in and then breathe out. Then hold your nose. Time it and write it down. Write the result down. And that is simply the controlled pause test. Now, following that, you breathe and sit quietly or lie, and for 5 minutes you breathe from your diaphragm. You do not speak, and you just breathe from your nose. And then you repeat the test, and what you will find for sure is a lowered pulse rate afterwards and an increased controlled pause afterwards. Now, what does the controlled pause mean? Well, again, it is how efficient your body is when you've expelled most of the oxygen out of your body. What's a poor reading? Anything under 20 seconds is considered inefficient. In fact, Dr. Butane found that a lot of his patients with a controlled pause of less than 20 seconds had multiple chronic diseases. Less so between 20-30 seconds, and even less between 30 and 40. And what he actually found was the minority, unfortunately, who scored 50 seconds plus, which is possible, had no disease, no illness. And this was across an age group of between 20 years old and 80 years old. So it's quite incredible what you can do for your health just by training the way you breathe. Now, over a 5-day period of doing the controlled pause in the morning and in the evening, you can improve it by at least 20-25%, and you'll notice straight away an improvement in energy levels. So that's the simplicity of the test. Finally, to work out how much you're over breathing, it's simple. You just divide how many seconds you did on the controlled pause into 1 minute, and that gives you your ratio. Excuse me. So if you are if your controlled pause test scored 20 seconds, you're breathing the equivalent of 3 people. So it's pretty inefficient. 30 seconds, you're breathing for 2. Really, you want to be building it up to 40 to 50 seconds, so your ratio is 1.1, 1.2. And that's far more healthy and far more efficient. It's an easy way to monitor how you're doing. The things that affect a controlled pause are obvious, really. A poor diet, being stressed, hyperventilation through stress, no exercise whatsoever, generally a poor lifestyle in that respect. These will all lower your controlled pause. But at least you have a gauge to see how you're doing, which is effective. Okay, take care.